Urinary catheterization is a procedure used to drain the bladder and collect urine through a flexible tube called a catheter. Urinary catheterization may be used to support urinary elimination in patients who are unable to void naturally. Objective is to learn how to insert and remove a catheter. Materials needed: cotton balls, betadine, Foley catheter, sterile water, 10 cc syringe, micropore, urine bag, kidney basin, and the sterile gloves. Procedure: check the patient's profile for the doctor's order. Proceed to the patient's unit. Knock on the door 3 times and read the patient carefully.
Good afternoon, Miss Jane. I am Christine, your caregiver for today. I am going to insert you a catheter.
Fold down the blanket. Note: you can turn off any cooling agents like air conditioner and electric fan before proceeding to the procedure. The assistant will prepare all the materials needed within easy reach only uncontaminated sterile field. You may put the bags containing the catheter and the urine bag between the patient's legs so that it is easily accessible during the procedure. Perform hand hygiene and apply sterile gloves using sterile technique. To expose the vulva, remove first the diaper and scrape any fecal materials if the patients are wearing one. Position the patient's legs in either lithotomy or frog position, hips and knees partially flexed, heels on the bed, and comfortably abducted. Clean the private part using a cotton balls with betadine. Gently spread the labia and expose the urethral meatus and clean from inner to outer in a circular motion. Now get the Foley catheter and apply enough amount of lubricant on the bladder opening to easily insert it. Discard the urine bag on the packaging. Remove the cup, then connect the drainage port to the urine bag. Gently retract the vulva. Then tell the patient to breathe through her mouth at the count of 3 and insert the catheter carefully.
Miss Jane, at the count of 3, please breathe through your mouth. 1, 2, 3.
Advance it to 2 to 3 inches until urine flow starts. Get the 10 cc syringe with a sterile water in it. Inflate the balloon with recommended volume of water that will serve as the lock. Make sure to hold on the red part on the balloon port to avoid pricking your finger. How the inflated balloon is done and what it looks like. Gently insert the syringe in the catheter valve or the balloon port. Do not use more force than is required to make the syringe stick in the valve. Allow the pressure within the balloon to force the plunger back and fill the syringe with water. If you notice slow or no deflation, reset the syringe gently. After successfully inserting the catheter, straighten the legs first before taping it with a micropore. It is to avoid forcefully removing of the catheter by stretch movement. Then secure the catheter to the thigh with a micropore and hang the urine bag on the bed rails. Do your aftercare. Then arrange the patient's gown and beddings to have a rest. Removing the catheter. First, wash your hands and wear clean gloves. Place the patient in a lithotomy position. Remove the micropore tapes one by one. Get the 10cc syringe, then aspirate to deflate the balloon. After deflating the balloon, throw the syringe on the yellow contaminated bin. Again, tell the patient to breathe through her mouth at the count of 3 before removing the catheter.
Miss Jane, at the count of 3, please breathe through your mouth. 1, 2, 3.
After removing the catheter and urine bag, do the double bagging, then throw it to the yellow contaminated bin. Do your aftercare. Then arrange the patient's gown and beddings to have a rest. Always return the patient to the way you have received her. Documentation. Document procedure including patient's tolerance of procedure, any unexpected outcomes, and urine output.